Experts researching the presence of new malaria-causing mosquitoes in Ghana have found the new breed in Nima, the third community to have the Anopheles Stephensi after Dansoman and Tuba. In the following report, Michael Ashale of our health desk explores the impact of this new breed on the country's efforts at reducing malaria.
Ghana is the 7th African country to discover the Anopheles Stephensi. Even though malaria data covering the period of its discovery is not immediately available, experts believe it may have been present much earlier than the date of discovery. Professor Yao Afrani is senior researcher in medical entomology and parasitology at the University of Ghana Medical School and led the team that made this discovery.
We don't know the extent of spread, how they are, but we found this by accident. Let me put it that way.
Nima becomes the newest community to record the presence of the new mosquito breed, described by the Ghana Health Service as stubborn and rough.
Through the work that we were doing, the research work that we did, we realized that Anopheles Stephensi is actually breeding within the city of Accra. When we found them only in two places, Dansoman and Tuba in Accra. Right now, we found that within those places they are widespread. We've also seen that they are also in Nima. These are new places that we did not mention initially.
The number of persons admitted in hospitals for malaria cases increased from 351,000 in 2021 to 438,000 in 2022, according to the data from the National Malaria Control Program. Professor Yawafrani believes these numbers may worsen.
So that means that in our country, if we don't do anything about it, what is happening in Djibouti and in Ethiopia would happen in Ghana. They would breed so much and they will cause epidemics of malaria within Ghana.
For many faced with tough life in the capital, this situation presents grave danger to their health. 26-year-old Joshua Asante is one of them. He migrated from his village to the capital in search of greener pastures. But what he found is far from green.
Living here is not easy. Things have become difficult for me since I come. Even though money where I used to buy clothes and other things have become very, very difficult. Maybe I'll wear a clothes by 3 days. I haven't even removed it. You understand?
Exposed to the elements, Joshua finds himself sleeping in the open, vulnerable to the relentless assault of mosquitoes.
During the night, you could not sleep at all. And this time, I think we are still in the rainy season. I think the climate change, so we are still in the rainy season. And if this time like this, it's not easy. You cannot sleep in the night at all. Sometimes I will sleep around 9. But because of the mosquitoes, my eye will open like 4 times before daybreak. Because the mosquitoes are worrying us, to understand. And one problem is malaria is worrying us too much. Every day, this one will say malaria, every day this, and we don't have money to go and buy medicine to understand, to treat that malaria. So we are suffering here, we are suffering. The mosquito is disturbing us a lot.
Samuel Morrison also sleeps outdoor, where he wrestles with mosquitoes every night and often ending up on the losing side.
You not sleep well. That's why. All because of mosquito. So help us to house mosquito, please. The ones that circle is very big. It gives us malaria cry. Oh, plenty people got malaria. Some people go home.
In places like Dansoman, we observed the drains were stagnant and choked with debris. But Dansoman appears one of their favorite spots. And areas like this drain that I sit on, stagnant with overgrown bushes, appears to encourage their population.